Hello and welcome to today's presentation, Wiping Out Infection, Choosing the Right Protocols for Cleaning and Disinfection. Today's webinar is being presented by Virox Technologies, makers of PeroxyGuard disinfectants formulated with accelerated hydrogen peroxide. I would now like to introduce our speaker, Nicole Kenny, Vice President of Technical and Professional Services at Virox. Over to you, Nicole.
Thanks, Laura. Welcome, everyone. I'm hoping today, in our short 20-minute time, that I'm going to be able to focus on protocol development, some of the science that is out regarding developing protocols, how to properly disinfect, and really making certain that you're getting what you need out of your infection prevention and biosecurity programs. And so it's not a single study that I'll be talking about, but a number of studies that have used accelerated hydrogen peroxide or PeroxyGuard product and other methodologies looking at how to improve cleaning and disinfection. And so off the bat, I'm just going to kind of sum everything up that what we're looking for is really there's three steps. One, that we're going to responsibly disinfect, that we have disinfection compliance, and that what we're doing has sustainable protocols. So things that we don't have to constantly change, confuse our staff, or constantly have to retrain our staff on what they're doing. And so first of all, if we talk to responsibly disinfect, really, this is where I would start as the bones. If you don't have a training program in place, you can limit the impact of your cleaning and disinfection guidelines. People have been taught at home, and unfortunately our parents haven't necessarily taught us properly how to clean and disinfect or read product labels. And so that's really important. And if we look at what's happening right now during COVID, we have over a 2.5 or 150% increase in calls to poison control, because as we're all increasing the use of disinfectants at home, we're using them incorrectly. And we've had toxicity issues, we've had respiratory issues. And this again is really important because as employers owning a company or working at a facility, we have to provide a safe work environment. And so it is important that our staff are using things properly. And so if we dig into here, first, it's about cleaning. And I know cleaning's not sexy, it's really not that fun, but it is vitally important in order to be completed as part of our disinfection process. And this is really important in animal facilities where there is going to be higher soils. So in areas where you're maybe doing some bench research and it's a relatively clean area, you can use a cleaner disinfectant and a simple one-step process. But when we're dealing with cages or larger areas or primate runs, as an example, we really need to make certain that we are cleaning, because we're going to have food residue, we're going to have feces, we have all sorts of different soils, and that needs to be removed. And so when we're looking at things, first and foremost is, what are we using? And in order to clean, we need to have a product that has surfactants or detergents in there. Think about washing dishes. We're just washing dishes by hand with water. It doesn't clean as well. We need that detergency property. And so that's really important in terms of choosing a product. And you can choose to have a detergent that you're going to use first, followed by a disinfectant, or you can choose a cleaner disinfectant that has detergent properties in it, and you can use that in your cleaning step, followed by your disinfection step for the areas that have the higher soil loads. There is the mechanics of cleaning. And that's, how are you going to clean the areas? Are you scrubbing? Are you using a pressure application? Are you scraping and sweeping prior to cleaning? And that is all really important in order to ensure that the soils are removed and that you're going to allow to get the disinfectant to the surface and kill whatever is on there. Temperature is important as well. Many of us feel or have been taught that you need to use the hotter the water, the better it is for cleaning. And that's really not true. Most products these days are actually looking at it from an environmental perspective. They're tested in just tepid or room temperature water, not hot water. And your detergents work quite well without the need to use hot water as well. So you can save money and resources by not overusing hot water. And of course, there's time. And how are you getting your surfactants to the surface and later on your disinfectants? And so if you're dealing with walls or stalls or things like that, you want to apply in a manner that you can see where it's going, where the product is going, but also that it's going to cling. And so in some of those larger areas, foaming is a really, really important way of doing it. And when we're training our staff, it's really being able to have, that ability to understand. We can't see what's on the surface. And so this is just an example of 3 different Petri plates, where the first one on your left is looking at an uncleaned surface that has just been swabbed and applied here. And if you were to look at the surface, it actually didn't have much soil, but we're seeing all sorts of colonies growing. We have a large dark one that's probably some sort of fungal pathogen. And then if we move over to the middle Petri plate, well, that's really what happens if we're cleaning. If we're just doing that, single wipe versus the one on the right, where it's disinfection, where we are actually cleaning and then reapplying and allowing the product to sit there. And so when we're training, some of these visuals and being able to show our staff what they don't see themselves is really important. And so, we've done different things where maybe you swab somebody's hand and you show them what happens, or, cell phones. None of us, myself particularly, even now, don't necessarily disinfect them frequently. And so they're probably one of our dirtiest yet most touched surfaces. And so giving that visual to see that, we look at something that looks clean, it's not necessarily clean. That is something that we want to get across to everyone. This is another example, and I do have a video that we're happy to share on our website. But what this is looking at is the product on the left is a quaternary ammonium alcohol product, and the product on the right is accelerated hydrogen peroxide. And so we're just showing that we have artificially soiled blood on tiles, and so they've been baked, so it makes it harder to clean. And then in your second image here, you're looking at, if we're comparing the two, they both look rather clean. And so to the naked eye, you're thinking that we've done a good job. What we're doing on the bottom here is using a hematostic. And what a hematostic does is actually look at any residual blood that could have been left on the surface after cleaning and disinfection. And so what we are seeing on the left is, even though the tile looks clean, when you use the hematostic, you're actually getting a reading that it is dirty, that there is still blood residue on the surface, versus accelerated hydrogen peroxide, which does not have any blood residue. So again, the importance of choosing products that have effective surfactants that are going to help pick up the soils from the surface. And this is something where I'm saying, do you have microvision? It's that idea of, we can't see. The tiles look clean, but here's just one example. We're not even looking for pathogens. We're just looking to see, is there any blood residue left? And it looks clean, but it's actually not. And then lastly, when we're looking at our training program, one of the areas, and I said in terms of the number of calls we're seeing to poison control, is the importance of safety. Chemicals can do harm. People do not always use them properly. And this particular slide is a summary of a couple different resources. There are a number of more recent publications that are even looking at the impact of chemicals being used at home. And what we are finding is that chlorine-based products and quaternary ammonium-based products are the leading cause for occupational asthma. So the more we're using them, the more we are exacerbating respiratory issues and leading to occupational asthma. If we're not using them properly, we can also run into skin irritation, whether we haven't diluted them properly or we're not reading the labels and using the appropriate personal protective equipment. And of course, there are products out there that if they get into our eyes, they are going to cause either temporary or even permanent eye damage. And we have seen that. I've worked with a facility, actually. It was a hospital in the Michigan area that had a number of nurses that inadvertently got product into their eye and did have an impact on their eyesight. And so this is really, again, important that when we're setting up our clients, or when I'm teaching our clients, but when we are setting up facilities, that everybody understands what they need to do and how to safely use the product. So that's really, in a nutshell, what we're looking for from that. How do we responsibly disinfect, and what are we doing about that? And so if we come into disinfection compliance, this is all about, from a quality perspective, how do we ensure that we are killing the pathogens that we're concerned, and so that our research isn't impacted, in that we can ensure that we're not going to run into an outbreak or have an issue, within our colonies that could impact the research. And this is really looking at, we've learned and we've taught our staff how to clean, and really have focused on achieving disinfection contact time so that they understand how long the surface needs to stay wet, so that we can use a product generally in a single application, so there's no need to pre-clean or reapply. And pre-cleaning, of course, unless we're dealing with incredibly dirty surfaces, but that we're going to achieve the disinfection compliance. And there's been a lot of science out there around this. And so here's a few examples. One, when we're looking at disinfection, of course, we have a number of different applications and surfaces that we're going to deal with, but choose your substrate wisely. And your substrate, by that, I mean, is your cleaning cloth. Are you going to use a pre-moistened wipe? Are you going to use a terry cloth, or are you going to use a microfiber? Those are things that you need to contemplate. Not only in what I'm showing here in this particular visual is just the difference in terms of how far a surface can be wiped, and the difference between the deposition, meaning that the cloth is releasing the disinfectant. Because if the cloth is absorbing but not releasing the product onto a surface, then we're going to have an issue. Because if the disinfectant doesn't get to the surface, we're not going to achieve contact time. We're not going to have the chemical that we need there to kill. And so some of the different discussions that we've had around this is meltblown polypropylene. These are your typical pre-moistened disposable wipes, and many products are coming into kind of like the smaller, the 6x7, your traditional ones you're going to use for smaller surfaces. And then there are 11x12s where you're going to use it for a larger area. What we do find is that those particular types of substrates absorb very well. And also, as you're wiping across the surface, they release evenly. And it's quite easy to determine when the cloth, the pre-moistened cloth is too dry and you need to replace it. With the loop microfiber, again, it's hit and miss. It might still feel wet and will push it further. The problem with microfibers, as well as the terry cloth, where you see over time that you start getting different dry spots, is that you need to understand the interaction between those two particular cloths and the chemical that you're using. And so cotton in particular is something that if you are using a quaternary ammonium compound, you want to watch out for, because there's a very well-known issue called quat binding. And what happens is you have your diluted quat into a bucket. And so whether you're using terry cloths or whether you're using a looped cotton mop, when you put the cotton into the quat, it absorbs and binds onto the cotton. So what you do is actually reduce the concentration of quaternary ammonium compound, and you reduce your ability to achieve disinfection appropriately. The same can happen with some microfibers. So again, when we're dealing with the use of that, we need to make certain that we are choosing our substrates to match with the products that we're using. And this is an example of where we're talking to contact time. So what we've taken here, the blue bars here are the contact times listed on the EPA product label. And then we wiped the surface and achieved statistical significance. And this is a peer-reviewed study that I've shared in the resources at the end. And the red bars indicate how long the surface actually stays wet after application. And so what we're looking for here is if your product dries before the contact time, you could have an impact on efficacy. And so once we realized or looked at, okay, how long does a quat, as an example, diluting it as per the label instructions, how long does it stay wet once you've applied? Well, it's a 10-minute product. It stays wet because it's a water-based solution for around 3 minutes. And then we tested to determine what the actual efficacy was at the dry time. And what we found here was in every time when you did not achieve the disinfection time, you were not achieving your disinfection. So quats, for example, really got less than a 3 log. So they weren't even sanitizing or achieving the level of what would be considered sanitizing. Accelerated hydrogen peroxide was the only product that exceeded the dry time, exceeded the contact time, and completely achieved disinfection. Bleach did come close. And of course, bleach, you have the advantage of having different concentrations. So you can increase the concentration in order to achieve your disinfection, but then you can run into some compatibility issues later on. But this is just the importance of contact time. And to give a better visual, this is actually a study that was done at Yale New Haven with Dr. John Boyce, who's quite an infection control expert in the healthcare area. And what we were looking at was improving cleaning practices and doing a double-blind crossover to determine how well cleaning, comparing their traditional products that they were using, which was a 10-minute quat, versus using accelerated hydrogen peroxide. Both of these were using pre-moistened wipes. And we were doing microbiological testing. And so what we have here in the middle are surfaces that were tested or swabbed prior to being cleaned. And on the right, what we have here are surfaces that were cleaned with a quaternary ammonium compound in one facility. And you're seeing that, yes, they reduced, it was cleaner, but there was still a significant amount of growth found. The column here on the left was the facility that was cleaned with accelerated hydrogen peroxide, the same chemicals found in ProxyGuard. And what you're seeing is there's a visible difference between what was on the surface, what was left on the surface, versus that of a quaternary ammonium compound. So again, really highlighting with that visual that contact time, the speed of disinfection, is important in order to achieve what you need at your facilities. You also need to look at how you're going to apply. And so this is another study. In both cases here, we're using accelerated hydrogen peroxide to show that even if you are changing the type of application, you can change your impact. And so what we have here on the left is a Petri plate that what we had done was spray, allow the surface to stay wet for 10 seconds, and then wipe it roughly around 5 times using a sterile cloth. And what we're seeing is that even though there was reduction from what the original was, there's still quite a bit of pathogen left there. Versus when we used a pre-moistened wipe and wiped the surface, what you're seeing here is, again, a significant reduction. So that difference between spray and wipe, which what most people do is spray and immediately wipe, so you're not achieving your contact time, versus the idea of what I'll call wipe and walk away, where you're able to wipe that surface, get the physical friction, apply, and allow the product to get to the surface, you're going to see a far better solution. And so really, again, going back and understanding what you're doing within your facility. But this is a good example of even within a product that has rapid contact times, the application can depend upon what your final outcome is. And so lastly, it's really looking at sustainable protocols. And so really, what is the responsible choice for promoting animal welfare, but also guarding people, equipment, and of course the planet? Because if we're using large buckets of solution, we are going to be dumping those down the drain, and that gets back into our drinking water. And so really looking at your biosecurity protocol from a holistic perspective. It's not just about your research animals or your staff, it's also the potential of what you could be doing to the environment and therefore impacting the community that you live in. And so again, examples that we need to look at for our protocols, and I touched quickly on quat binding earlier, but here's another example where we're using the cotton cloths, and this is looking at the contamination. So again, that double dipping, going back and forth and not changing that solution. And so that's something else needing to be looked at. Are you better to use a concentrated product where when you're using a bucket and you're re-dipping back in, you are contaminating the mops and buckets and therefore having the chance to potentially redeposit pathogens back onto a surface, versus using a pre-moistened or a dry microfiber system where you're either applying the solution in front of your mop and that is disposable, or if some of them can be washable, but it's really, you're only using that particular cloth or mop for that particular area. You're not going to be using that multiple times, and you're not dumping that back into a solution that could potentially contaminate. And then, of course, there's looking at our surface compatibility. When you have a facility, have multiple different types of surfaces within there, and so you really do need to take that into contemplation. And there's also how you're going to save time with with wet versus dry cleaning. So, are you in a room where you don't have a drain? And so you really need to minimize the amount of solution that's going in there so that you're not flooding surfaces and, not creating slippery floors or having issues with compatibility, versus areas where we've seen the bottom right hand here, these two areas where you could actually go in with a pressure washer, and you could spray or foam and make certain that you're able to get to all the surfaces. And so really looking at your facility from the ability to use what I would call a dry system, where you're going to limit the amount of solution that you're leaving on the surface, versus a wet system where you can go in with a foaming application because you do have a drain, and so it's not going to be as much of an issue. And of course, making certain we're achieving contact time. So in conclusion, really, I'm hoping what our takeaways are is that cleaning is as important as disinfection, and particularly in those areas that we are going to be dealing with soils and feces and other things. We need to make certain that that is removed and that we're using products that have detergents to help lift those soils from the surface. Training, I cannot, undervalue. It is so important. And I've worked with a number of hospitals where we've done studies looking at improved training and seeing the reduction and a correlation in the reduction of hospital-acquired infections. So I know that when we invest in our staff and we invest in training and we invest in building protocols that they can use and they can comply with, I know that we can see an outcome, not just from the reduction in amount of product that you're using, reduction in occupational health and safety issues, but a reduction in pathogens in your surface or in your area. And so really not running into any concerns there. And that's where really protocols are important. As much as I hate following instructions, I will say when it comes to cleaning and disinfection, this is one area that we do need to follow instructions. And so in conclusion, it's really, the approach to cleaning and disinfection requires thoughtful consideration of application and protocols to ensure the ease of implementation by investing in training and product selection. And so I hope that I've been able to share some of the science today. And this is a summary of just a few of the studies that I've used in terms of, highlighting the importance of them. And thank you very much on behalf of Virox and PeroxyGuard. Thank you.
Well, that concludes today's presentation. So if you have any further questions, please visit peroxyguard.com. And thank you, Nicole, and thank you to everyone for watching.